Namaste, myself Dr. Soumya Hullannavar. I'm a lead specialist at EliteAyurveda. I'm over here today to talk on a topic, exercising safely with diabetes. So many does know diabetes and exercise are very important, and exercising with diabetes also sometimes have few complications depending on the maybe a stage of your diabetes. If at all if you're in a diabetic complications, then accordingly we have to deal with. So every individual with diabetes are recommended to exercise routinely to take care of your glucose or sugar control, and definitely that also reduces your cardiovascular risk developing cardiovascular diseases as well. So a complete exercise plan ought to be necessary as a part of any diabetic management plan. So let me just brief you how we have to do and why we have to do. So performing physical activity regularly helps prevent diabetes as well. There is something called, you would have heard, like pre-diabetic stage. If at all if you are in that, then regular exercises will definitely help you to postpone your diabetes. So exercise is especially important part of overall health and mental well-being as well, irrespective of whatever the medical condition you have got. So it's not only diabetes, I'm saying any other diseases also. Exercise will help to keep your maybe your weight under control, maybe your tension like pressure, blood pressure, maybe your cholesterol values, and a psychological stage also. Maybe like psychological issues, maybe your small depressions or anxiety, panic attacks, that will also be taken care when you exercise every day. So what else the exercises could help you in that, keeping the blood sugar in specific to diabetes, that will always make sure your blood sugar levels are under control. It improvises the sensitivity to insulin as you start, as you know, type 2 diabetes, they have lost the sensitivity to insulin. That will also be improvised. The excess fat gets reduced and your muscles are built. So the muscle protein will develop when you start exercising, and the unnecessary fat starts shedding down. The heart related diseases gets reduced, or let's say the risk of heart diseases will be reduced. So few people also ask me which are the best exercises if I'm a diabetic. There are few physical activity which is also shown in particularly it helps to reduce your insulin resistance and your blood sugar as well. Maybe I could say aerobic exercises that I have seen helping many people. Maybe a high intensity interval training. We say that you have to go with a high intensity interval training. They'll just make you to do a very good exercise, and then they will be interval. Then there will be a particular trainers for that, and maybe a strength gaining exercises. So it's not just a running or a cardio. There will be a particular muscle based strength gaining exercises that has also helped to build their muscles. As the muscle build has improved, I have also seen that insulin resistance power has also been responding better. So we would suggest you at least up to 1.5 hours of a brisk walk along with any exercises you do is also very important, because cardio plays a very important role for our general well-being as well. So if you are diabetic, I would say you should also try to follow yoga, brisk walking as I already said, maybe a cycling, a swimming is also a very good exercise, and maybe resistance that comes, resistance band exercises. So holding it for a second using that particular band, so that particular leg and arm exercises are there. So if at all if you want to start with any other new fitness exercise other than these, whatever I mentioned, these are very generally practiced, then I would suggest you have to meet up your experts, because depending on your age and your diet plan, the exercise can also be changed accordingly. So I would also like to mention few things like few safety steps to be followed when you are diabetic and you are exercising. Maybe yes, as I already said, you can also consult your doctor which all exercise you are planning. Maybe a simplest exercises also for the routine. You should be, before performing the exercises, I always recommend you, if at all if you are using insulin, then you have to check your blood sugar level sometimes. Like if you feel anything bit low, then make sure just don't rush for the exercises immediately. So you have to check your blood sugar. If at all if your blood sugar varies between let's say 100 to let's say 130 to between 180 and all, or random maybe up to 250 depending on what time you had the food and all, is okay for you to exercise. If it is less than 100, then you have to skip your exercise for the day maybe. And the best time to exercise is approximately after 3 hours of eating, when your blood sugar levels are high, or maybe within 3 hours. We say our postprandial will be after you have the food, we will take the blood test after 1.5 hours. but after that, after 2 or 3 hours, the sugar levels could increase. So that is when your sugar levels are high and your stomach is also empty, it's a right time to choose to do the exercises. Low insulin levels can lead to increased production of ketones while exercising, so you have to be careful about it. That could also cause you nauseous and disoriented sometimes, which will lead to a diabetic ketoacidosis. That's a condition you end up with. So you have to make sure drink at least maybe a half cup of a fruit juice, or maybe a bit of anything which gives you a bit of carbohydrate, the energy to improve your sugar levels when you are doing the exercise. If you take a break in between, or maybe have a half apple, or just crush and have it, because if at all if you have worked out continuously for more than 30 or 40 minutes, then take a 5 minutes break, and you can also have a 1 cup or a half cup of juice as well. And check your sugar levels maybe within 15 minutes, or repeat your blood sugar levels becomes normal to exercise. If you feel, if at all if it is increased, then you can repeat it and then check it. If you are already on insulin, then you have to be careful about this as well. It's a great concern if blood sugar is low during exercise. If it is high, then yes, you can also take a chance. Maybe you can wait for some time, then you can repeat, then you can do. But if it is low, then as I already said earlier, you have to skip the exercises for the day maybe. If at all if you are planning for any long workout, then yes, you have to, like for cycling, if you are going for a cycling for 3 hours or 4 hours, 5 hours and all, then you have to make sure you are carrying your to test your sugar level, you have to carry the kit with you, so that if at all if you feel any giddiness or any changes, then you have to check it immediately. And if at all if you feel if your sugar levels is going below 70, then you have to immediately stop whichever the exercises you have to go for the medical help. So there are a few more things, like post exercises, what I have to do if you are a diabetic. You have to make sure, like if at all if you have undergone a strenuous workouts, your sugar levels will definitely be affected as well. So you may continue with the low sugar levels maybe for 4 to 8 hours even after the exercises. So you, as I said, you have to choose the right time for exercises. So what you could do is you can have a bit of a snacks like protein bars, maybe if at all maybe 1 or 2 dry fruits, just to make sure if you start feeling the sugar levels are dropping down and you have really done a very good workout, then you have to eat something post your workouts. And check your blood sugar if you feel like any symptomatic changes post your exercises, especially if you are type 1 diabetic, I mean you are dependent on insulin, then this matters a lot. And if you are feeling dizzy, then as I said, you have to immediately stop the exercise, and immediately you should have some fruit or maybe a crackers or a glucose tablets. That is very much necessary, because most of the time you feel giddy, your sugar levels have gone down. So burning more than 2000 calories per week via exercises is very much necessary to control your sugar levels. So the best to choose physical activity that you enjoy and can engage in a regular exercise. I would always suggest what you love, you do that. So in that you can do it with love and passion, then you will not really go through all these sugar levels ups and downs. So testing your sugar levels as required is also important during your exercises, and you have to manage those records so that you will understand. Maybe if at all if you are an initial beginner, you have started with the diabetes now and you have started with the insulin very recently and all, then all these tips are very much necessary to consider. So exercising safely with the diabetes is very important. It's only not exercising is important, you should also take care of your safety precautions when you exercise and you are a known case of diabetes. Thank you.